Hey guys, so this is my thyroid removal surgery story, and I don't want to upset anybody, but if you're my friend, my family member, um, if you're not a person who has thyroid cancer, don't take this the wrong way. This video is not really for you. This video is not just for me to get attention. What I really wanted to do was if there's anybody who has been diagnosed with thyroid cancer and is going to have surgery and they want to know what my experience was like, that's what this is for. So if you're just my friend and you don't really need to hear all the details of my surgery. I mean, you're welcome to listen, but I know when I was going into surgery, I had never had any kind of surgery before. I had no idea what to expect, and I knew a couple people that had had this, and I kind of asked them some questions, but I didn't get a great idea of what to expect. And the unknown of it really scared me. So I am hoping that I can take that anxiety away from someone else potentially who is going to go there. So the short story is I had a small, like 1 centimeter papillary thyroid carcinoma, and I saw the surgeon and we decided that we were going to take half my thyroid. So it was scheduled for a couple weeks later. A few days before surgery, I went in and had some blood work run at the hospital. They got those results, and then I had to call in. My surgery was on a Monday, so Friday I had to call the hospital and find out what time I had to be there. So they told me to be there at 8:15 in the morning for a 9:45 surgery that Monday. I did something really dumb. The paper that they gave me said that I wasn't supposed to have any alcohol the day before. I thought I had read it well enough. I did have a glass of wine the night before. Turned out not to be a big issue, but if you're going in for surgery, don't do that. They don't like it. So I got there that morning to the hospital at 8:15. I went to the outpatient surgery center, which I just followed the signs, and they checked me in, and you're going to get asked your name. You're going to ask your name, your birth date, and what surgery you're having about 7 times. Like, everybody who sees you is going to ask you those 3 questions, in addition to others, like when was the last time you ate, do you have any allergies, and other basic historical stuff. But the big ones, I mean, you should know your name, your birth date, and what kind of surgery you're having. And so at first I was like, I'm having thyroid surgery, and they're like, well, what kind? Okay, so I'm having a right hemithyroidectomy with Dr. So-and-so. They asked me that a bunch. So they asked me that, and when was the last time I ate? I did a little paperwork, signed a consent, sat down in one area. Then someone came to take me back to a different waiting area. There was a volunteer there, and she said, y'all can have a seat as soon as there's a place ready for you to come back to get ready for surgery. They'll let you, the patient, go to your bed first, and then after you are redressed in your gown, all ready to go, then they'll allow your parents or whoever's with you to come with you. So Joe and my mom were with me. We sat in the waiting room for maybe 10 minutes or so, and then a volunteer came to get me. She took me back, weighed me. I asked the kids to leave me alone for 10 minutes. We'll see if we get that weight. They took my blood pressure and a quick pulse ox, had me get totally undressed, so everything off and on. They gave me these Clorox wipes, so they asked me to wipe down everything. Of course, I was nervous and sweating like a pig, so they wipe your pits, wipe your everywhere that you can get with these 2 wipes. Go to the bathroom, get in your if you're a woman, they'll have you pee in a cup to make sure that you're not pregnant, because the anesthesiologist does not want to knock you out if you're pregnant. So I peed in the cup. Yay, not pregnant. Get into your gown. Then they took some, like I said, they took some vitals. And then once I had put all my personal belongings in a bag, and then they take that bag to a locker. And then whatever you don't want to send to the locker, you can leave with your parents. So at this point I had taken all my jewelry off. I took my trusty companion that never leaves my side. I took this off, looped it around with my phone. I did hold on to my phone until right before they wheeled me back to surgery, and then I handed it to my husband. So got in the gown. Then a nurse came in and started, getting me ready. Tried to place an IV line in one hand, and it's been 2 weeks, and you can still see the bruise. It blew pretty spectacularly and pretty immediately, but stuff happens. I told her quite honestly I was getting a little lightheaded, and she immediately dropped the head of my bed down, so I was laying flat. And then she was able to get the IV line in my other hand without a problem. Started running some fluids. The anesthesiologist came in, and he was real quick. Like, any problems with anesthesia? Like, never been under before. I had checked motion sickness in my like pre-anesthesia questionnaire, and so they put a scopolamine patch on me, which is a little round patch they put like right behind your ear, that's good for motion sickness. And they did tell me, don't touch it, and if you touch it and then touch your eye, it'll make your eye dilate and you could have some blurry vision, because it can do that. So I tried not to touch it, even though it itched a little bit. That, I want to say they told me could stay on for 3 days, so I did leave it on until like the next day. Then my mom and Joe and Mel were able to come in, and it was kind of like we just sat around and waited. At some point my surgeon did pop in. She drew a couple of little marks on my neck, and she told me where my incision would be and just walked me through, what was going to happen. One of her staff members came in and talked to me, because they were going to do nerve monitoring on their recurrent laryngeal nerve. Sometimes can get damaged during thyroid surgery. So my doctor uses a special monitor, and so she was discussing the special monitor, and that it would entail a couple of stickers, and that her job was to keep an eye on that nerve and make sure that everything was going okay there. And then it was like, hurry up and wait. So I was there, ready to go. Surgery was supposed to be at 9:45. I want to say they finally like came to get me around 10, which is, fine. The nurse anesthetist that was in charge of me actually went to the same university as me, so that was kind of cool. We were both Buckeyes. So when they came, to get me, I handed off my phone and my Apple Watch to my husband, and off we went. So they took me to kind of another like holding area, and I got to meet all new people. So the nurse that had put in my IV and run my fluids and done my vitals and stuff pre-op, we said goodbye to her. Went into this new area. The nurse anesthetist was there, and she put EKG sticky leads on my back. The person from my surgeon's office who was doing the nerve monitoring came in and put some stickers up the side of my arm that were attached to wires that I assume plug into something. There was just so many people. There's so many people involved in doing this for you, and they're all taking great care of you. There was a nurse, I want to say, who was associated with my surgeon. She said that she would be assisting. Once again, I was asked name, date of birth, what procedure are you having? And at this point, I went doctor nerd, and I asked the anesthesiologist what drug she was going to give me because I was curious. So she explained to me that I was going to get a little Versed, which should help with anxiety and just kind of bring me, into a happy place. That then she would give some anti-nausea medication through my IV. I want to say there might have been antibiotic and maybe IV Tylenol. I can't remember. But she liked to get the anti-nausea medicine on board first. And then once I was in the surgery room, they would give me some lidocaine. She said because the propofol is thick and it may burn. So that I would get some IV lidocaine and then IV propofol, which would put me out, which is exactly how it happened. So from there, they rolled me into the actual surgery room, and she gave me the Versed in my IV line, and it was like pretty immediately I could feel calmer and a little dizzy, maybe a little sleepy. When I sat up, they pulled my bed up next to the surgery table, and they asked me to sit up and scoot over. And when I sat up, I was a little dizzy, and suddenly everything seemed really funny. And I remember like laughing a little bit and scooching over and laying down, and then sort of scooting this way and that as people were kind of moving me and positioning me and putting me where I was supposed to be and moving the pillow under my head and getting all my leads hooked up. The nurse anesthetist put the oxygen mask over my face, and I remember her seeing her above me, looking over, and she said, "How you doing?" And I said, "I'm better. I'm calmer." And it really wasn't very long after that. Like, I remember having the oxygen mask over my face, and everybody was moving and talking. It wasn't long after that that I sort of caught sight of the anesthesiologist over my right shoulder with some syringes of stuff. And the nurse anesthetist said, "Okay, here comes your lidocaine." And it was weird. I felt kind of numb all over. Like, most of us have had maybe local anesthesia, Novocaine with your, or local, like I've had sutures in my finger, local anesthesia. But it was weird. It was like everywhere. I could feel everywhere felt numb. And then the propofol went in and I was out. Like, one minute I was looking up at the surgery lights above me, and then the next minute I was sleeping. After that, like, the next thing I remember vaguely was someone talking to me. I don't even remember what they were saying. I just remember that it sounded like they were trying to wake me up. And the nurse anesthetist had said before she put me under that I would hear her voice when it was time to extubate me, to make sure that I was awake enough to have the tube out. And I think maybe I remember someone telling me to exhale, but then that was real vague. The next thing I remember, I was in the post-anesthesia unit, and I remember there was like a nurse's desk in front of me, and there was little bays with different people and curtains separating us, and across the nurse's desk there was a clock. I remember looking at the clock and thinking it had been a little over an hour and a half since I had last looked at a clock. And I was just sort of chilling there. Someone came and brought me a warm blanket. Before I was fully awake enough to ask for one, someone came and tucked me in with a warm blanket, and my throat hurt. My lip was swollen, like right here. I looked like I had a fat lip. I remember one of the first things I remember the nurses sort of talking about over me was, "Ooh, look at her lip, it's kind of swollen." And someone offered to get me, that my recovery nurse offered to get me some ice chips. So, and she also asked if I wanted some pain medication. She asked me to rate my pain, and then I said, "Yeah, sure, I'll take pain medicine." They gave me something IV, which later I found out was fentanyl. It made me sleepy. It didn't really make me high or give me any happy thoughts. It just made me feel warm and sleepy. And so they said, take your time, waking up. So I went back to sleep for a little bit. And then when I next looked at the clock, I think it had been a half an hour or so since I had looked last, and she was popping ice chips into my throat again. And they started to sit me up, take the EKG leads off my back. And then things get a little fuzzy. It's funny because you think that you're more with it than you are. At some point, they moved me out, like I sat up out of the bed and I moved into this recliner that had wheels on it. And she asked me if I would like some hot tea because my throat hurt. I remember asking if they had any chapstick. And you would think that, with the mouth being dry and everything, some chapstick. I was like, "Vaseline? You got anything?" They didn't have anything. So my lips stayed dry. Oh well. Worse things have happened, but I was alternating the ice chips and the hot tea, sipping, and they wheeled me in that recliner thing back into the same place that I was pre-op, where they put my IV line and everything. By this point, I had a different nurse, and after I was sitting there for a few minutes, they let my family come back in, and they brought my bag full of stuff. And I don't remember all of this real well. Like I said, I thought I was more with it than I apparently was, because I can't remember the exact sequence of what happened. I remember everybody coming back in, and I hadn't even thought about my incision, and I remember my mom was like, "Ooh, they didn't put a bandage on it." And that was the first time that I even thought about this. I assumed they would put something over it, but they hadn't. So the nurse got my discharge instructions together. She helped me to the bathroom, and then I got myself dressed. She went through my discharge instructions with my husband. She told him like when I could have my next pain medicine, because they sent me home with some oral pain meds. He said when I could have the next pill of that, and what sort of medication I could take at home. And I usually am an ibuprofen taker. They recommended Tylenol. I didn't think to ask them if ibuprofen would be okay until like the next day. I called to ask and they gave me the okay. So for that night, I just did Tylenol. And then I was able, they sent Joe out. They said, go pull the car around, and she'll be, yeah, they wheeled me out in a wheelchair. And it's funny that I don't remember a lot of this real well. They wheeled me out in the wheelchair, and then I got in the car, and Mom went home, and we went home. And I was texting some of my friends on the way home and showing them pictures. That was the first time I actually saw my incision, was in the car on the way home. And I'm going to make a different video to talk about recovery. So like I said, this video is basically just for anybody who's going to have this surgery and you want to know what it's like. I had read, what was the book called? It was by a veterinarian. Uh-oh. Oh no, it's just a dog coming in, not a child. I had read a book called Lucky Dog, and it was about a veterinarian who had thyroid cancer. This is my lucky dog, my lucky snugglebug. What do you think, Mr. Man? And her, she did, talk about her surgery. She had a hemithyroidectomy and then a completion thyroidectomy where they took the other half. So she had 2 surgeries, and both times she was inpatient, stayed in the hospital, and her experience was tremendously different than mine. Actually, reading the book didn't comfort me all that much. It was, sorry, my dogs are getting into things. Do you think it's kids that are going to be an issue? But her experience was a little rougher than mine was. So I think from the people that I've talked to, my experience was a little more typical, and hopefully that's the way yours will go. But feel free to contact me. I'm happy to tell you any more. Like I said, I'm going to make a different video about recovery and what that was like. But thanks for listening. We'll see you guys later.